We normally would be talking about a plenary discussion now, but I think it can be taken for granted that we have done that. Thank you very much. So next, we'll invite our dear sister and friend, the illustrious and much awarded communications guru consultant to NPHCDA, Sister Eunice de Mesa, to please come forth with the key takeaway.
Thank you very much. I think the hand of applause can be better, not for me, but for the very great panelists that were just left. Thank you very much. I think it's been a very active engagement. But then, as somebody said, one of the panelists said, we'll be doing a lot of talking. This is time for action. And for us to have actions, we need to agree collectively. What are the takeaways from this engagement? So we're going to go through what we believe are the takeaways, but where there are gaps, please, I'll be relying on you to fill in the gaps, okay? So because we are in this together, remember? So in no particular agree that there's need for a shared understanding of what accountability really means. And we also need to ensure performance-based funding. If you don't agree with any of the takeaways, let me know. If you don't want to take it outside this door, please let me know when I finish. We also did agree that there's need to conduct an analysis of the policy implications of the new LGA autonomy. In terms of innovative funding and innovative financing, we agree that there's need to establish a committee to advocate for the allocation of a proportion of the same tax to PHC. There's also need to scrutinize the National Health Pact and the swap approach for a better understanding of what it entails and what the roles of both government and non-government actors should be. In line with the swap approach, we did agree that there should be need for alignment on prioritization, financing, and indeed tracking of progress. We also need, for this engagement, we need to track our resolutions. The resolutions from this engagement, which is what I'm going through now, that we need to track them because it's no longer just talk. This is time for action. We also agreed, even before the ED left, that there is need for the for the NPHCDA to integrate the CSOs into the ongoing conversation it's having with the states and the local governments on the implications and operationalization of this autonomy of the LGs. There's need to promote public-private sector in the PHC subsector. That is public-private partnership in the PHC subsector. And we also agree that as partner agencies, both as corporate entities and individuals, we need to actually join the advocacy in order to ensure that there's effective utilization of available resources, especially at the subnational level. And that we need a communique from this. I think it's also what we mean by resolutions, a formal communique from this engagement. Have I missed out anything? Is there anything you want me to drop? Feel free. It's a dialogue. We are all involved. These key takeaways are for all of us. Minority voices are allowed. It seems we are all aligned. The alignment has started, right? Thank you.
Well, that's a summary of most of the discussions that transacted in this hall this morning. We say it's time to begin to talk about some of these critical things. And what we have just done is to assemble some of the highlights of this conversation that all of us can use subsequently as talking points or as sound bites for our advocacies for PHC. We are wrapping up now, and our brother, the arrowhead of options, Dr. Ufoma Omaibi, will be on this podium in a moment for the closing remarks. Please encourage Ufoma. No, we say encouragement too. You also encouragement. Oh, let us encourage you. What do you say?
It says I need encouragement, but I'm like David today, and David encouraged himself. All right. Where do I start from? I want to start from that video that wasn't played. Now, today has been a great day. I know a lot of people have enjoyed today. You have some fantastic feedbacks. You've heard a lot. We have quite a fantastic takeaway, but I think it's very important because what we are talking about when she mentioned we need to really define the accountability thing is something that it's good to see. So are you able to play it? So can you do that now?
And when we already saw that this was a very huge and that because it's something who has very good back on something like center for joining the and joining so when that was for and that is the trouble with scorecard. Okay, we bear on the analysis so that we can prove or take the rate of this. From the secretaries and they don't have it. For our all we do is two actors. You have to get a good director. There will be no progress. How will we very well? So this scorecard that was presented to the information after. The making that is different. That is every friend. I was trying to tell you that I cannot tell you the tendency. That's for time because it's spiritually, it's values his role, it's values his role. And I think this would be bigger of that ground finding things to do. this is our something else.
We didn't do anything, we are respectful, I will strengthen and stress. So now, trying to look at this data, and I'm going to do that, and we're going to use that business to do what the fly or go to this level, or the citizens of course. We are like the, only one group that, so, or the Senegal, or doing the back. You see that they actually work with the whole department. Available time for them to defend it. So all these gaps will take the fire. During the meetings that we have to do. And I know that they're very similar. 3 years for that. That's why we're now at 0 for that.
And then when we now started working with the graduate, not only in the general hospital, the secondary facility, as well as at the primary health, at the primary health hospital. So the started working in graduate graduate. I knew they would this. Last year, we had 2019, 20. We have the Euros forecast of in all possibilities. Even the in about 3 years, after that, I'm feeling that it has different setup that like the access the Taliban and the Taliban of the channel. And recognizing the how this is resolved. I'm talking about the injection of income profit. I'm talking about injection of system. I'm talking about how where pediatric and then neurosurgery is needed for childhood and diet in children. So they have this is something it will practice. And you are specific. What do you do? What are the problems? I think it's for. You have to think that too. If you are doing that for you, you have to decide how much of use you have. Now, we're going to do. I will do that. If we do that, for fantastic evidence that we're utilized and especially in practice on the moment of people who have their accuracy. You say that. Yeah, I think it's a mistake. After that, it's not good. It's very difficult for you to advise. And since we have a direct position, we must be able I think that the role of university is highly similar because it has afforded to new services, whether it is at the point of gas and at the point of whatever is around the these two revenues are always available. Universities government to achieve work. I will just put them in the previous one. We have the good listening industry. You are listening to the things to drive the process. For you to decide one second to all that. If you would do that, then you need to allow it to be done. That's so. Even that, you so like that. We say, and the thing for it, the second one is that we have director of good advice. What I say that. Which one is good at for yourself? You will examine what are what's in this and where it is. I will not on that.
You can stop it there. You can stop it there. You can stop it there. Thank you very much. You can hear the last word he said. The last one is the involvement of the coalition. And that's what my colleague was talking about. The Lagos State-led accountability mechanism, SLAMs. They play a very critical role in driving that agenda. And that's why we're talking about ensuring that we harness multi-stakeholder approaches to driving sustainability of intervention or even co-creating the solutions, as it were. Like my colleague said earlier on, the African Mamaye Collective is here. It's a coalition of all the slums across Africa. And that's why you have quite a lot of them around. In my hand, and if you have a copy, you can wave it, is their strategic plan. And I want to invite you to have a copy of this. It will be available outside as you go. We want to present it to the public. It's part of the outcome of the Mamaye program, that the collective is now there. They have a strategic plan that would last until 2027 now. It has actions, their membership from across the country and across the continent. Please do find some time to take a look at it and to understand a bit more what they do. Thank you very much. MC, over to you.
Well, thank you very much, Doctor. In the next activity, Dr. Laude will be up here. He will wrap up this engagement. He will share with us what our next steps would be, and he will say thank you to you for coming.
Okay, thank you very much. So I think my task is very, very simple to say thank you, and it's very, very simple to say, but at the same time to highlight a number of next step. I think in terms of next step, the very beautiful takeaways read out by Madam Eunice, we are going to develop it further and share for us to know what we agreed upon in terms of our key takeaways. And at the same time, we'll be looking at translating those takeaways into action. The number of things there, like for example, commissioning a study on what is the policy analysis of LGA financial autonomy, what is the implication for PAC. I think it's the important thing that we are going to do. And things like ensuring that when the dashboard comes out, because the ED mentioned they're going to put in place dashboard, I think all of us need to work to interact with dashboard so that we use it for action and give feedback. It did emphasize the importance of feedback for us to be able to do it to the NPHCDA. So a number of things that we'll be doing, and then we'll be communicating those things from time to time. But we're not actually stopping at engaging the NPHCDA. Like we said the other time, we have engaged the National Health Insurance Authority. A number of things came out. One of what came out we are following up with is doing a client satisfaction survey to find out from different regions of Nigeria how satisfied enrollee with the health insurance. So we'll be doing that as much as possible. And of course, we'll be meeting from time to time to appraise where we are. And then there are a number of action points for that is contained in the work plan of Nigerian USC Forum. And let me echo what Dr. Lekki said about the need for all of us to be active advocates when it comes to health issues, join one association or the other, Nigerian USC Forum, Sector Reform Coalition, the Health Advocate. So now in terms of vote of thanks, the most important thing is to thank God for making it possible for us to assemble here. Many people actually travel from as far as Yobe, from Akwa Ibom and other states. People actually travel. My very good friend from Delta is here, and many of us that actually travel from far and near. We thank God for making it possible for us to converge. And then we thank each and every one of us, starting from the National Primary Care Development Agency. They are from the first very day we interacted with them. They welcomed the need to interact with the audience like this, and the ED was very supportive, and he actually delegated members of his team. I don't know, is Bashir here? Oh, okay. Dr. Bashir and other members of the NPHCDA have been very wonderful in terms of putting this together. And of course, our immediate constituency Nigerian USC Forum members, we thank each and every one of us for the great work. The options, they play a dual role. They are members of Nigerian USC Forum, but at the same time, they play a very supporting role. We really appreciate. Can we appreciate all members of option here available here? Okay, thank you very much. And all members of Nigerian USC Forum, can we stand for recognition, please? Nobody want to stand? Okay. Thank you very much. And again, our medical elders in the room, the likes of Dr. Lecky, thank you very much for always being there. Whenever you invite him, he's always very willing. That's the only thing he does now to ensure that the health system improve. And he's doing it pro bono. And that's the important news. Dr. Udo Maswa, another medical elder in the room, thank you very much. Tired but not tired, still providing very support to the health system from grassroots up to the policy level. We really appreciate that. Dr. Babagana and the executive of the State Primary Healthcare Board, Association of CEOs of State Primary Healthcare Board, under the able leadership of my very good friend, Dr. Adis, and for making it happen. Thank you very much for playing a very wonderful role. To all the donor agencies here present, apologies if I don't mention some names, the like of USAID, the FCDO, Bill and Melinda Gates Foundation, and many other GIZ, SIV, and those that are online, we really appreciate each one and every one of you. And of course, UNICEF. I would like to forget UNICEF. That is very strategic for me not to forget UNICEF anyway. Sachin and Eduardo, thank you very much for the wonderful role. And all the implementing partners that are here, the like of LHSS, Options itself as well. Thank you very much. The civil society in the room, thank you. And of course, our journalists that are doing very great job. And that each and every one of us, including our online participants, the Secretariat of the Nigerian USC Forum, and my immediate team members, DJI Consult, thank you very much for the great work that you are doing. And the members of the audiovisual that are doing a very great job to ensure that we are seen and heard across the globe, because many people join from different parts of this world. And again, and of course, I can see my brother from Pathfinder over there. I don't know if the art has changed and all those stuff. So, so again, the Health Sector Reform Coalition, who is the mother of all CSO in the health sector, thanks for all playing that fatherly and motherly role to ensure that we get it right in the room. And of course, to our big brother, Chief Fayo Sinlu. I've been hearing his name on the radio since I was in primary school. In those days in Kwara, I used to be, this is a news, whatever, read by Ayokomi Osilu, and he's still there looking like a young person. I don't know how he's doing it. So thank you very much. So we pray that God Almighty Allah, God will continuing to give us the wisdom, the energy to do the right thing, to move the health system forward in Nigeria, so that in no distant time, people will be coming to Nigeria to come and learn best practices when it comes to health sector reform. Thank you very much.
And that brings us formally to the end of this engagement. Thank you very much once again. The closing of the event is designed to be closely associated with lunch. So what we should do ideally is to transit directly from this hall into the foyer once more. But this time around, you would notice that there are no sitting arrangements in the foyer except for the food setting. So you please go to the foyer, get your meal, come back into the hall to your space, and then be convenient with your meal. That's the arrangement. Thank you very much again for time and your attention. God bless you all. See you at lunch.
Mm-hmm.